Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning. This is the Senior Moment Show. I'm your host, Sid Roeder, and visiting today with Tracy Ferris. She's with Blue Water Health Insurance. Did I get that right?
You got it right.
Good morning.
Good morning.
It's good to have you here. Let me really quick, before we start to dive into all the fun things you have to tell us, let me tell our listeners about our sponsor, which is the Empowering Seniors Group. It is a group of professionals like Tracy that have dedicated their time and effort to provide information to seniors, their family members, caretakers, and all those great people that listen to us every Saturday morning. If you'd like to find out more about the Empowering Seniors Group, you can do so online at empoweringseniors.info. You can also email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any suggestions for this show, anyone you would like to see us invite, you can reach me personally at 435-512-6406. So, Tracy, Tracy, you are obviously doing health insurance and things like that, Medicare. And our favorite subject, Medicare. Let's dive into that. What's going on with Medicare?
Yeah, there's a lot of things that I have realized over the last couple of months that people just need to be reminded of. Typically, a person has to be 65 years old to be eligible for Medicare. They have a window to enroll, and that is 3 months before their birth month, the month of their birth month, and 3 months after their birth month. So it's a 7-month window where they can enroll into Medicare Part A and Part B, and then, at a minimum, they have to add a drug plan to that. There is also a place where they can be penalized for Part B and Part D if they don't enroll when they are first eligible at 65. Now, there's a caveat to that, and that caveat is that they are not working at a job that provides insurance. So, for example, Sid, if you worked for the hospital, let's say, and you plan to continue to work until you were 67, you don't have to go on to Medicare at 65 because you are working at a job that has qualifying health insurance. So there's just an extra form that has to be sent in at the time that you would want to enroll into Medicare at 67, but it does exclude you from any penalties that would incur as a result of not enrolling at 65. And that's a big misconception among people. I have a client who his wife is convinced that he has to do it at 65, and she's still working and provides their insurance. And he has probably asked me 4 times, are you sure that I'm not going to be penalized? It's like, yes, I'm absolutely sure. I do this all day long, every day. Yes, you will not be penalized for having not taken it at 65.
So quick question there. So the penalty, is that over all things? What if somebody misses that 7-month period to enroll and comes to you, whatever, at age 66?
Yeah, unfortunately, you can't just, if you miss that window, you can't just enroll in Part B whenever you want to. And Part B, again, B as in boy, that is one of the places where they will penalize you. So if you miss that window of 7 months, we might have to wait a little bit before you can enroll into Part B. And so, yes, that penalty would start to click up. I'm not sure what the word is, but the penalty would start, and that penalty follows you your entire life.
Okay. And so when it comes to who should someone talk to when they're enrolling? Obviously they can talk to you, but...
Yeah, I think an agent is really the best person because, again, that's what we do all day long, every day is, enroll people and help with that process and manage it and keep track of it and, all of the things that are really important. when people enroll, I like to meet with people 3 months before their birthday. That gives us time to get Part A and Part B in place, because that's just, we do the enrollment, but then it turns over to the federal government to actually, get them enrolled and send out their Medicare card and all those things. So you know how it goes with the federal government. Nothing is fast there. So we want to start that process 3 months before their birthday so that we can get things really solidified before they actually have Medicare. And their Medicare will start the month of their birthday. So even if their birthday was May 31st, their benefits for Medicare will start May 1st.
Okay. And just out of, to clarify for our listeners too, how often should you revise your plan after you're enrolled?
Yeah. So once their Medicare card comes in the mail, then they call me back and we meet and we talk about what plan they want to take. They really have two options, either a Medicare Advantage plan or a Medicare supplement. If they choose a supplement, we have to add a drug plan to that. And so every year during open enrollment, assuming that they're happy with their supplement, we would just reevaluate their drug plan to make sure that we have them on the right one for the next year. Separate from that, if they chose a Medicare Advantage plan, that is something that can be changed every year during open enrollment if they wanted to. Doesn't mean they have to, but they have the ability to do that. So one time per year, it could be changed.
That's great. Well, let me see. What else have I not asked? Is there anything that we're about 1 minute and 15 seconds away from our first break? Anything that comes to your mind that you'd like to share?
Well, there is a little bit of a misconception about that time frame. And I've had a lot of clients call me in the last couple of months saying, 6 months, it's 6 months before my birthday, I need to get in and see you. We can't actually do that. So it's not 6 months. That is thrown around a lot, this 6 months, and we can talk about this in the next segment as to why. But it's 3 months before their birthday.
Thank you. Well, we are coming up on our first break here in a hurry, and we'll also make sure when we come back that we, if you want to grab a pen and paper, that we will throw out Tracy's contact information in case somebody would like to get in touch with Tracy. Again, this is the Senior Moments Show. We are sponsored by the Empowering Seniors Group. If you would like to find out more about them, you can do so online at empoweringseniors.info. But now we're going to take a short break. Stay tuned. We'll be right back.
Need a helping hand? The Bear River Association of Governments, also known as BRAG, is here for you.
They assist seniors with in-home services, provide utility bill relief through the HEAT program, and offer rental assistance to keep you housed.
Need help with tax prep? Their experts ensure you get the refund you deserve. And for veterans, they're here to connect you with the benefits you've earned.
BRAG is your local resource for a stronger today and a more secure future. Call today or visit brag.utah.gov.
Did you know 10,000 baby boomers qualify for Medicare every day? Did you know that you'll start to get swamped with mail about Medicare 6 months before your 65th birthday? Did you also know it doesn't cost anything to use an insurance agent to help you navigate through all those offers? Hi, I'm Tracy Ferris with Blue Water Health Insurance. Let me help you understand all the offers you're receiving and find the plan that fits best for your situation. Call me today at 435-890-8155.
This is Oliver with Cache Valley Pharmacy. We're working with Cache Valley's own Focus Pharmacology and CacheMedical.org to help you lose weight the right way with supplements that support your weight loss journey and easy telehealth appointments from the comfort of your own home. When you think weight loss, think Cache Valley Pharmacy, your partner for a healthier, more confident you. Visit us at CacheValleyPharmacy.com or go to CacheMedical.org to start your weight loss journey today.
I think Mom needs a little more help. What I really need is a boyfriend who can drive at night.
Hi, this is Bruce with Comfort Care. With Comfort Care at your side, you can live your best life possible. We know families can't be there 24/7, which is why we can help with as little or as much home care as you need, so you can live in your own home on your own terms.
Could you give me a phone number? My daughter was texting.
Together with Comfort Care, you can live your best life possible. Call us today at 754-7676. That's 754-7676.
Are you tired of feeling unwell and not knowing why? At Next Level Health and Wellness, we hear you. We specialize in uncovering the root causes of your discomfort, whether it's gut health, hormone imbalances, or emotional and mental blocks. With personalized plans, advanced lab testing, and evidence-based holistic nutrition practices, we guide you toward lasting health and wholeness. Awaken your healing potential with a team that listens, understands, and supports you wherever you are. Visit nextlevelhw.com to start your journey to feeling better today.
Welcome back. This is the Senior Moment Show. I'm your host, Sid Roeder, and today I'm visiting with Tracy Ferris. She's with Blue Water Health Insurance here in Logan, and we've started talking about Medicare, and I did promise that we get out Tracy's contact information in case you have any questions. She is ready to answer.
Yeah, so my phone number is 435-294-2161.
Perfect. And we talked a little bit about that 6 months period that's thrown around for people to sign up for Medicare when they're around 65. And maybe just because it was so interesting to learn, let's talk about again that 6 month period. It's not quite the way some people think.
Yeah, like I said earlier, I've been getting a lot of calls about this, but I think where the 6 months is coming in is if a person chooses to have a supplement, they have a 6 month window to enroll in that from the date of their Part B effective date, which would be, the first day of the month of their birthday. They have a 6 month guarantee issue, meaning they don't have to answer any questions. There's nothing. They can automatically get it. The insurance company has to take them. So I think that's where there's a misconception about the 6 months. That 6 months does not apply to their enrollment. It's 7 months or 3 months before their birth month. So.
Okay, perfect. Are there any other things that people typically get confused about?
As far as Medicare goes, I think we've hit the high points. There is a lot of misconceptions among Social Security, and I would like to talk about that. In my line of work, I am amazed at how many people have questions about Social Security, which makes sense, right? Because when they're coming to me, they're 65, they're getting ready to retire. I'm really amazed at how many financial advisors don't know a lot about Social Security. So in an effort to just be able to answer their questions, I've really done a lot of studying and research on Social Security and the benefits there. But I think the biggest misconception, and this was brought to mind not too long ago because I had a client come in, and financially, Social Security is pretty much all that they have to live on. But he was receiving benefits, but his wife wasn't. And so when I asked him why his wife wasn't receiving benefits, he indicated that she had never worked outside the home. And as a result, she did not have any Social Security benefits available to her. I paused and looked at him for a minute and I said, well, you know that she's eligible for half of your amount. And he was like, what? And I said, yeah. And he said, well, she tried to take benefits earlier, but they told her she didn't have any benefits available, so she couldn't. So he's like, we just assumed that she couldn't. So let me clear that up a little bit. Number one, if I'm going to take benefits off of my spouse, I am not eligible for those benefits until my spouse has started taking his benefit. So when this client that I was just referring to, when his wife called in, he was not taking benefits yet. So they were only looking at her Social Security card or her Social Security number under her and seeing that she did not have a benefit available. So that part was true. But it changed once he started taking benefits. So in my situation, I was a stay-at-home mom for several years. I've only been in the working field for 15 years doing what I'm doing right now. So I'm not going to try to catch up to where my husband is. That just doesn't make sense. He's got a benefit that will be significantly higher than mine, no matter what I do at this point. So rather than, being self-employed, rather than trying to figure that out, I already know that I will take half of his amount. So that does not affect his amount. In hypothetical numbers, let's say he takes, at full retirement age, which for him is 67, and let's say his benefit is $4,000. He still gets the $4,000, but once he starts to take his benefit, I am eligible for half of his amount, assuming that I take it at my full retirement age, which is also 67. So he would have $4,000, I would get $2,000. So our combined amount would be $6,000 a month that we would be receiving from Social Security. So that's one of the biggest misconceptions. The other misconception that I hear a lot from people is people thinking that the full retirement age isn't important. It is very important, and here's the reason why. Depending on what year you were born, and at this point, 1960 and up, their full retirement age is 67. So what does full retirement age mean? That's not where you're going to receive your highest amount from Social Security. That would be at 70. But what full retirement age means is that 67 years old, if you want to continue working, you can, without any cap on how much money you can earn. If a person takes their Social Security prior to 67 or their full retirement age, and they are still working, the federal government puts a limit on how much they can earn, and anything above that limit, they are paying back $1 for every $2 that they earn above and beyond what that threshold is. That's a really important misconception, because once you take Social Security, you are locked into whatever that benefit is. So you get a reduction in the amount that you would receive. So at 67, I'm going to receive 100% of my Social Security. At 62, I'm only going to receive 70% of it. So if I take it early and am still working, you can see where that would be a really big, huge financial decision that would not be good for you as an individual.
Absolutely. We're already coming up on our second break here. Maybe really quick, Tracy, your phone number once again, in case somebody has questions for you.
Yeah, it is 435-294-2161, and I'm located in downtown Logan.
Thank you. This is the Senior Moment Show. We're going to take a short break. Stay tuned. We'll be right back.
It's tough knowing how to care for an aging parent. Mom has always been there for me, but now I need to be there for her. When we found out she needed surgery, I wondered how I could attend to her needs and still be mom to my kids. I was so relieved to learn about transitional rehab at Maple Springs in North Logan. From the nurses to the physical therapists, it was like their whole staff was focused on helping Mom get better. Maple Springs in North Logan was an answer to my prayers.
Learn more at maplespringsnorthlogan.com or call 753-9400.
Did you know 1 in 3 people will visit a nursing home? Did you know that once there, they will stay there for an average of 3 years? Did you also know there are insurance options that can help cover this experience? Hi, I'm Tracy Ferris with Blue Water Health Insurance. It's not cheap to stay in a full-fledged nursing home. Long-term care insurance can help you or a loved one get the care they need and deserve. If you wait until you need it, you may be too late. Give me a call at 435-890-8155.
Thanks, Mom. Thanks, Dad.
No problem, sweetie.
I can't believe you're able to fit everything in that little sedan.
When they move out, you can move on to a house that fits your life. It's time to live in a space that fits your family.
Hi, this is Sid Roeder with Achievement Realty.
Let me help you to find a home that suits your needs and is less to take care of. Save money or even make money on the sale of your current home. Call me today at 512-6406, then list it, sell it, and move on.
Picture this. Your family's locked in court, fighting over your home and your assets because there was no plan. Don't let probate decide your future. I'm attorney Justin Wall with Wall Estate Solutions. Stay in control with wills, trusts, and smart planning that keeps your family out of court and your wishes protected. Get peace of mind today. Visit wallestate.law or call 435-294-0346. That's 435-294-0346. Your legacy, your plan.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a pre-arranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts pre-arranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most.
Getting around your home should be easy and safe. At RT Med Mobile, they provide wheelchairs, stair lifts, ramps, and electric lift chairs to help seniors maintain independence and comfort. Their friendly team offers free in-home consultations to find the perfect solution for you or your loved one. Locally owned and here to help, call 435-260-6171 today. RT Med Mobile, because your mobility matters.
Welcome back. This is the Senior Moments Show. I'm your host, Sid Roeder, visiting today with Tracy Ferris. She is with Blue Water Health Insurance here in Logan, and we've talked about Social Security and Medicare. And maybe let's circle back a little bit to the whole Medicare thing, because as everybody knows, I'm an immigrant, and so there are some qualifying factors for you to be able to apply to Medicare.
Yeah, there are, and so Part A is usually free, and that is free because whoever's taking the Medicare, has worked for 40 quarters and paid into the system. But again, now we're kind of going back to that rule of, well, wait, what if I didn't work and didn't? So, can I get Medicare or what? And again, yes, you can take that benefit off of your spouse who has worked 40 quarters and paid into the Medicare system. So I know it can get very complex sometimes, and especially in like your situation, Sid, where you are an immigrant. There are so many rules around Social Security and Medicare that I think if there's anything that we can send home today, it's use an agent. It is so important. We train on this stuff all the time. It's our job to know what the rules and regulations are. And people who have any kind of circumstances that are special in any way, shape, or form absolutely need some help navigating it.
Right. And you mentioned before when we were talking on the Social Security issue that you're actually taking some education there. Is that correct?
Yeah, there's a designation out there. It's a registered Social Security advisor. And yes, I am going through that process right now just because, like I said, I field questions all day long every day from clients about it. And so I just decided, you know what, I'm going to do this training just because I think it brings value.
That's fantastic. Do you see any other challenges that people are dealing with when it has to do with Medicare signing up or Social Security? Anything that comes to mind?
Nothing that comes to mind right off the bat, but I do think one thing that is important to know is, we were talking about full retirement age, and at this point, anybody going forward turning 65, their full retirement age is 67. But I also had a client come in who was 71 years old, and he was waiting on Social Security because he wanted his benefit to grow. And I kind of looked at him and scratched my head and said, obviously you don't understand what's going on here. So here's how it works. After age 67, your benefit is going to increase 8% each year until age 70. And at 70, it will not increase beyond that. So this guy basically had missed out on 1 year of Social Security payments because he thought that it was going to continue to increase the longer that he put it off. That is not the case. At 70, it does not grow, so take it.
Yeah, that's really good advice. And this maybe ramps me up again. Like you said, it's important to talk to an agent about Medicare, even better if that agent understands Social Security. And so I know we've already mentioned it twice, but let's maybe hear your contact information and your location one more time.
Yeah, so my phone number is 435-294-2161. And I am located at 74 West, 100 North. We're downtown Logan. I'm in a Farm Bureau building on the outside, but just rent a space at the back of that building from them. So that's where I'm at.
Great. We only have about 2 minutes left, so I'm going to ask you if you have any fun client story, obviously without names, that you can share where you felt that your service really did them a good deed.
You know, I mean, that's always a good question, and I guess I hope that everything that I do is always bringing value to people. But, you know, the other day I met with a gentleman who currently has PEHP, which that's the state's insurance. And so usually people who are state employees have PEHP. And so he came to me with his Medicare card and said, I need to choose a plan. And I said to him, well, you don't need me because PEHP does their own thing and they pay a benefit to them and it's a whole big thing. And he said to me, I've only been a state employee for 4 years, and so those benefits don't apply to me. And so we were able to, go ahead and get him on a plan of his choosing. But it's interesting because even within that scenario, he did his homework coming to me knowing I don't have that benefit like so many others do, and so I need this. And me just assuming that everybody had that as a PEHP, a state employee. And, so it's really good if you kind of know what you have through work. Auto leave is another one. They have a program, where their employees need to stay with them because they pay them money even in retirement. So there's just so many things out there that are scenarios that make everybody's circumstances so different.
That is the truth. Well, Tracy, thanks for coming in. This is the Senior Moment Show. Sadly, we are at the end, but we hope you tune in again next week.